To introduce myself, my name is Austin from the Alterra Health team, and we like to make these sessions as interactive as we possibly can. And so, if you have questions, please write in. If you're a provider on the call and you've seen something in the clinic or work with a patient and have an idea or an example you would like to share, please use the chat window in Zoom and share that, and we'll be sure to mention it to everyone on the call. We are expecting a combination tonight of both patients and providers. And so we're going to try and touch on concepts that are relevant to both audiences. If you have questions that you would like to speak with one of us from the Alterra Health team specifically, you can respond, just hit reply to the Zoom confirmation email, and that should go straight to Whitney. And my personal email address is Austin, AUSTIN, at alterrahealth.com, Alterra with two R's. And before I pass it over to Whitney and then also Dr. Katz, I just want to mention if you're a provider on the call and would like to know more about Alterra Health, we take all of the lifestyle work off of your plate. We have a comprehensive education and support platform that patients can access anytime, anywhere, on any device to help with lifestyle from nutrition, exercise, mindset and self-care, accountability, support. If you're interested in learning more about that, again, reach out to us. You can visit our website, alterrahealth.com with two R's. It's faster and easier than ever to get started with us. And so I just wanted to mention that. We host these events all the time on an ongoing basis. And so if you enjoyed this, we would love to see you in another one. If you would like your patients to join, again, please reach out to us. So with that, I will turn it over to Whitney, and Whitney will get us started.
Hello. Hi, everyone. I'm Whitney Gibson, registered dietitian and co-founder of Alterra Health. I am so excited to be here with you today to bring you information about this topic. I have had friends, family, patients who have struggled with this condition for years, and I'm happy to be able to help each and every one of you, whether you're attending as a patient or a provider, to help you and your patients manage your lifestyle in a more healthful and supportive way with both this class and the toolkit that you'll receive. So a little bit about me. I am passionate about holistic health, and my mission as a provider and at Alterra Health is to bring tools to clinics where typically the patient meets with the provider or doctor first, not the dietitian. It's important to me and everyone, I think, for you to have the right tools at your fingertips to adequately educate and support your patient in the areas of nutrition, exercise, self-care, as it relates to PCOS, or even just developing a healthier lifestyle in general. I've designed programs and resources to empower both patients and providers through education and support, just like this class. And I truly believe that with the right tools and collaborative approach, we all can reach our health goals together. So we've got 5 top questions tonight that we hear the most about PCOS. And we've got the amazing Dr. Katz with us, who works closely with our community in leading tonight's workshop as our expert. Dr. Katz, I'm going to have you quickly introduce yourself and give a brief intro.
Good evening, everybody. Thank you for the opportunity to be here, and thank you for joining us. So, as stated, my name is Leon Katz. I'm a medical weight loss specialist, but for my first 20 years of my medical career, I was doing bariatric surgery. So I kind of bring the experience from both sides of the story. On the one hand, I've helped people through surgery to lose the weight. On the other hand, I've used medication to help people to lose the weight. The concept is simple. In order to get healthier, the weight has to come down. The way we accomplish it, that's different and has to be adjusted for each patient. So hopefully we get a beneficial talk tonight because, as Whitney mentioned, polycystic ovary syndrome, it is really, really highly prevalent in women and especially in those that have elevated weight. So let's work at it together because we can all help each other. I'm certainly
Yeah.
here as someone knows a little bit, but I want to hear from the audience so we all learn from each other.
All right, so now what you're all here for. Let's dive into these top questions so Dr. Katz can share his expertise. I'll be wrapping it up with the last question on nutrition and PCOS management. So, first question, Dr. Katz, why is it harder for people with PCOS to lose weight, and what role does insulin resistance play?
Okay. So let me see if I can break down a very complex concept into something that people can appreciate and understand and take home. So definition of polycystic ovary syndrome. First, let's define it because it's like easy to throw out those four letters. So number one, the woman has an abnormal menstrual cycle. So that's number one. Number two, there's clinical evidence of elevated testosterone. Now, the clinical evidence would include, for example, increased hair deposition throughout the body. It also would mean some loss of hair on the head. And so these are clinical uh, things that, as a physician or healthcare provider, you can see upon examination. And last but not least, ultrasound would show multiple cysts, usually more than 10, on the ovary. That's the definition. Okay, we've defined it. Insulin resistance. Basically, as the testosterone level goes up, which is one of the findings in someone with polycystic ovary disease, the insulin resistance also goes up. Why is it difficult to lose weight? Here's the reason. Because there's insulin resistance, just like the word sounds, resistance, normally insulin helps glucose, sugar, go into your muscles and other tissues in the body, liver. When there's resistance, that sugar is traveling throughout the bloodstream. It goes from the bloodstream into one area that it's welcomed, which are the fat cells. So there's increased storage of energy. The fat cells get bigger, and hence the obvious weight gain. The big challenge is the more person gains weight, the greater the insulin resistance. So if you combine elevated testosterone, which is classically seen in PCOS, that leads to increased insulin resistance, which then leads to weight gain, which then leads to increased testosterone. So you can see this vicious cycle. And our goal tonight is to discuss how we can stop that cycle and hopefully reverse it to go the other way.
Great answer. I think you summed that up very well. Second question, how do hormones like insulin, cortisol, and androgens impact appetite, metabolism, and fat storage in PCOS?
Okay, so kind of repeating a little bit from earlier, but in terms of how those hormones impact it. So testosterone, ordinarily in the brain, there's a special hormone that causes release of sex hormones from the ovary. The challenge is the way that those signals go, the ovary makes far more testosterone compared to estrogen. So while in men, that means potentially bigger muscles, greater muscle mass. In women, it kind of throws off the whole cycle. That's number one. Number two, the increased testosterone that's mentioned earlier, unfortunately, leads to insulin resistance. So those two are kind of a vicious cycle together. Now, as far as fat storage, as mentioned earlier, the more insulin resistance a person has, the greater amount of fat storage. The fat storage, and here's where it gets really frustrating, the fat storage is part of the metabolic picture, we call metabolic syndrome. A lot of fat goes into what's called visceral fat, the fat in your belly. That's the bad kind. The subcutaneous fat, the one that you can see in your arms, on your hips, while maybe unsightly to you when you look in the mirror, that one is not going to hurt you or health-wise. It's one in your belly. Now, that one is very difficult and problematic. It causes inflammation throughout the whole body. So those are the events going on. So it's not just fat storage, it's where it's stored. And it's being stored in the abdominal cavity, causing inflammation and cardiovascular disease.
All right. Number three, what medication? So this is probably why a lot of people are very interested in this class tonight too, because GLP-1s are the hottest thing for treatment of many things at this point, and they're starting to become approved for many more conditions. So what medications like metformin or GLP-1 receptor agonists are available for PCOS related weight struggles, and how do they work?
Okay, so great question. I'm going to give a little punchline, GLP-1s, great, powerful medication, but they don't directly, literally directly affect the hormones involved with PCOS. There's a punchline. The way I think about medication and PCOS, realistically, it's basically treating the symptoms. So, for example, for women with a problem with their menstrual cycle, usually their OBGYN will prescribe birth control pills, although birth control is maybe not the correct term, but medications that will improve and control their cycles, make them more regular. So there's a whole list of medications that are basically designed to improve the function of the ovaries and the whole gynecological system. That's part A. Part B, there are medications that help the body become more sensitive to insulin, metformin being one of them. Metformin is a great example of a medication that contributes to greater insulin sensitivity. And as mentioned, that's one way to kind of break that cycle. If there's better insulin sensitivity, the sugar is not being put into the fat cells. So that's metformin. And interestingly enough, metformin is being used off label by us in healthcare to help people lose weight. The weight loss is pretty minimal. So it's not a great weight loss medication, but certainly metformin is one of them. There are other medications designed to basically help with the insulin level, the blood sugar, sensitivity to insulin. The problem is some of these medications, while they're helping, they're hurting because they cause weight gain. So it's kind of a wash. Good news, your body's a little more sensitive to insulin. Bad news, you've gained weight. So you're kind of chasing and nothing good is happening. So GLP-1, the bottom line with GLP-1 is what probably most people know on this call. It helps people lose weight. And by losing weight, ultimately, that's really the main treatment for polycystic ovary syndrome. By reducing weight, that improves insulin resistance. Insulin resistance improving allows for the symptoms of the inflammation and increased testosterone to go down. I realize this is very confusing, but I'm hoping I'm able to put it in the right direction. Do any of the folks that are on this presentation, do any of you have questions? Or Whitney, are there any things I didn't answer that I think I did, but you may be like, we're still confused about it.
I think you gave a good introduction and overview of specifically GLP-1s and how they help. I just wanted to add one thing. GLP-1s can a lot of people who have PCOS will have extreme cravings for foods, which I'm going to go over in my portion, but GLP-1s are known to help reduce those cravings. But at the same time, there has to be some kind of coordination with nutrition care to also help reduce cravings, not just depend on the GLP-1 itself.
One thing I can add, we were talking earlier about metabolic rate and metabolism and how to increase it. Is it possible that the metabolism gets slower, faster? What happens with polycystic ovary syndrome? Logic would dictate women with PCOS have a slower metabolic rate. Science dictates that it's obviously not that simple. I looked at certain papers that indeed indicated the women who have PCOS, they tend to get hungrier sooner. So, for example, a woman with normal function of the hormones, they eat a meal, at about 3 hours later, they're hungry. A woman
Hmm.
with PCOS eats a meal, and about an hour later, they're hungry.
Hmm.
So that certainly contributes to a greater intake of food. And metabolic rate, it really didn't show a significant difference.
No. We do have one question. Is phentermine a good medicine for weight loss for someone with PCOS and insulin resistance?
Phentermine is a good medication for weight loss, so that's part A. In terms of how phentermine plays a role on this whole cascade, I have to say, just from doing my homework and research, I personally have not seen any information about the increased catecholamines. which is basically what phentermine causes. I haven't seen increased catecholamines. One could make the argument that the metabolic rate could go up a little bit. So that's the only comment. But in terms of phentermine having a direct effect on PCOS, probably not. But a direct effect on weight loss, that's a definite.
I would say the main mechanism of action whenever it comes to phentermine would be specifically for appetite suppression. And you would have to, of course, talk to someone about what nutrition interventions are you going to have in coordination with that? Because you can't just depend on phentermine itself. You'll end up not eating anything at all, or risking not having a balanced diet and being way too low in calories, not meeting nutritional adequacy. All right, next question. This is your last question, Dr. Katz, and then I'm moving to me. All right, what are the best long-term strategies for maintaining weight loss and keeping PCOS symptoms under control?
Well, probably the easiest answer is to keep the weight under control. If one can keep the weight under control, then the symptoms of PCOS are going to be diminished. But it's a challenging circular argument. Well, if I have PCOS, it's hard for me to lose weight. So how can you tell me to keep the weight off in order to reduce PCOS? I think the practical way I would say it is your choice of nutrition, and Whitney's going to do a much, much better job. Doctors don't get taught nutrition. That's just reality. So your nutrition, and not just having less food or less caloric intake, but specifically in terms of the glucose, glycogen load. So that's one part. So that's the nutrition. Exercise, keeping in mind, exercise does a great job of helping you not to regain the weight that you lost. Generally, for people, normal people, not some football player or a marathon runner, normally exercise does not cause significant weight loss. Weight loss is predominantly the food intake, not the exercise. So exercise keeps your weight lower when you get there. And of course, medication has its role. I'm not a fan of just telling someone you have to stay on this weight loss medication for life and you can never get off of it. I think if you work with a well-trained weight loss physician so that two of you have a good relationship, I think it's perfectly reasonable to come to the point of either getting off the medication or staying on the lowest dose. And if that helps to keep your weight under control, I think that's a win-win.
Perfect. And I want to add to that, there's not a world that exists that medication alone will do anything. And you have to consider your entire lifestyle when we're talking about care for anything. This could be PCOS, it could be weight loss in general. And assessing your entire lifestyle is the best way to intervene anything. So assessing your sleep, what is the quality of your sleep? What is your stress level? Can you even identify your stress? Where's that stress coming from? Are you overloading yourself with obligations and scheduling? And you have to really assess your entire lifestyle if you're trying to create a healthier lifestyle for yourself. And that all comes down to a healthy weight also. So there's things that are just constantly just being thrown at us that equate to and contribute to systemic stress and inflammation, and that does come down to your lifestyle. So really digging deep and assessing all areas of your life in the areas of nutrition, exercise. When I say mindset, sometimes I'll say mindset, but really I'm talking about self-care, and that's going to come down to stress management and sleep. I'm probably missing something right here because I'm not looking at something, but addressing every part of your life would be the best way you can approach this, in addition to any kind of medical management if necessary. So I wanted to add that part. And then now it's my turn. Oh, hold on. Jennifer, is fasting something that would help PCOS? I'm going to get to that actually, so hold tight there. Okay, number 5. So my question is, what are the most effective dietary approaches for managing PCOS symptoms and supporting weight loss? So I want to start by saying the main goals with nutrition is, number 1, helping improve hormonal balance. Number 2, regulating blood sugar levels. And number 3, supporting overall well-being, which is what I just said in the previous question, assessing sleep, assessing stress, that type of assessing. But before we dive into this section, I want to give a reminder that everything that I'm getting ready to go over will be a part of that toolkit that we're providing. So I'm not going to go into super amount of detail because you'll get more detail in the plan or in the guide itself, along with checklists and trackers. This plus much more. So if I'm talking to providers right now, there's a lot of providers on the call. All of this stuff can be found in our education platform, which clinics use to support all lifestyle change, whether it's talking about weight loss, hormone health, heart health, exercise, you name it. We've got it for both patient and provider access as a valuable tool to your clinic. So enough about that. We'll move on to the first diet pattern that we recommend. And I try to avoid the word diet. I don't like that word necessarily. So I typically substitute that with diet pattern. So number 1 would be a low glycemic diet pattern and foods. If you've never heard of the glycemic index before, it's also referred to as the GI index. We don't need to get into what this chart is or numbers or anything. Just know that there is a glycemic index which measures how quickly a food raises your blood sugar levels. So a low glycemic index or a low glycemic food or diet would focus on foods that have slower impact on blood sugar, helping to improve insulin levels or insulin sensitivity. So when we're talking about the glycemic index, we're really talking more of carb foods. If we're talking macronutrients, we're not talking about protein necessarily, fats, or we're talking more carbs. So we're going to choose fiber-rich carbs like vegetables, beans, lentils, whole grains, which digest slowly. So these keep you full and also support gut health. That's a whole nother masterclass in itself, which we will have coming up probably next month, gut health. Prioritizing slow digesting options. So these are whole foods with fiber. What this does is provide a steady source of energy and also helps prevent blood sugar spikes. When I'm talking to a patient about what your blood sugar levels should be every single day, it's not a bunch of this. Okay, there's not a lot of hills and valleys or dips and spikes. There is basically just a even keel, kind of, more little tiny waves, and that would be okay. So if we're having a lot of ups and downs, that's definitely a reason to assess your diet and the timing of your meals, which I'll talk about in just a second. Limiting refined carbs. Refined carbs meaning they're just crappy. White breads, pastries, sugary snacks, things that are void of fiber, they're void of protein, they're void of healthy fats. There's just really nothing in them. You eat them, they go into your bloodstream and out just as fast, just really jacking up your blood sugar. Balance your meals. Pairing fiber-rich carbs with a protein and a healthy fat can further support your blood sugar stability. We have to find balance. We'll talk more about that in just a moment as well. Focusing on nutrient-dense choices. So instead of cutting out carbs completely, and all my providers out there, I really recommend that you do not stay in clinic, get rid of carbs, don't eat this, don't eat that, cut them out completely. We don't want to make drastic recommendations. Instead of cutting out carbs completely, we want to opt for the right carbs, which would be the higher fiber carbs. We want to opt for whole fiber-rich carbs, basically minimally processed options that actually fuel your body rather than harm them. So second eating pattern would be Mediterranean style eating pattern. So this diet is widely known for its anti-inflammatory benefits, its heart healthy approach. I don't like to throw a diet eating pattern, even like the Mediterranean style, onto anyone. I don't even like half the stuff that's in a Mediterranean diet. However, a lot of people do, but it's hard to follow a specific eating pattern. But if we can kind of look and see what types of foods are these? Oh, well, I already like a lot of these foods. Well, you're already kind of incorporating Mediterranean style foods, but just really incorporating more of those types of foods in your diet and lessening the other stuff. So when we're talking about inflammation, since inflammation is a key factor in PCOS, this diet can do wonders for reducing oxidative stress and also promoting better hormone regulation. So just a few examples to throw your way. Optimal foods would include lean proteins like fish, poultry, eggs, plant-based proteins, healthy fats like olive oil, nuts, seeds, high fiber fruits and vegetables, whole grains and legumes. And this one I want everybody to hear because it's not really spoken about too often, I don't believe. Herbs and spices for flavor instead of excessive salt to avoid water retention. Those with PCOS may have a large problem with retaining water or retaining fluid. Remember this rule: where salt goes, water goes. So if you have high salt intake, you're likely to retain a lot of water. So use those herbs and spices for flavor. What you want to limit or avoid would be processed meats and fried foods. Processed meats are going to be super high in sodium, salt, water, and fried foods. You want to avoid refined sugar and excessive dairy. Dairy can have an inflammatory response in the body, so that's the reason behind that. I'm not saying don't eat dairy. I'm just saying don't eat excessive dairy. And then lastly, excessive alcohol consumption. So get that alcohol out of your diet if it's in there on any kind of regular basis. That just increases inflammation. Number 3, balanced macronutrients. So this is something that is way more approachable to a patient, especially if we're trying to make lifestyle changes. So being able to identify what the heck is a balanced macronutrient diet? What the heck is a macronutrient? Macronutrients, we have 3 of them: protein, healthy fats, and carbohydrates. This is what we're talking about when we're talking about balancing of meals. So balancing protein, healthy fats, and carbohydrates in every meal, not just one meal a day, not just 2 meals a day, every meal can ensure that you're regulating your energy levels, managing your cravings, which is huge. Promise you, if you really prioritize balancing your meals, you're going to not have cravings hardly at all. And we're stabilizing the blood sugar, which is actually directly in line with managing cravings as well. So again, optimal foods would be protein. So chicken, turkey, fish, tofu, if you want plant-based products, Greek yogurt, eggs. Fermented things too are very gut healthy. So your yogurt and tofu, those are fermented items. Healthy fats, olive oil, avocado, nuts, flax seeds. How can you start to layer those into your meals or blend them into your smoothie? If you don't like them, hide them. That's what I like to say. Complex carbs. So when we talk complex carbs, the word complex, the way I remember this, it's harder. Like the word complex means hard. So hard to digest, not in a bad way. It's just slower to digest in the system. So sweet potatoes, brown rice, quinoa, lentils, and then fiber-rich veggies. Those aren't going to go away. Leafy greens, bell peppers, carrots. This is not an all-inclusive list by any means. Again, we've got resources in our content library that have fiber list, protein foods list, anything you could want. Limit and avoid highly processed carbs. Again, you're going to see that again. White bread, white rice, chips. So those are void of any nutritional value. Sugary snacks and beverages should also be limited and avoided. I'm going to leave you with 5 tips on top of that, and then we're going to talk briefly on intermittent fasting, and then we'll wrap up. So 5 huge tips. You want to eat smaller, balanced meals to regularly avoid blood sugar crashes. This is all about blood sugar management and insulin sensitivity. So we have to eat smaller, appropriate sized meals and balanced meals. So if you're a meal skipper, you're only eating 1 or 2 meals a day, that's not sufficient. I know all right off the bat, you're not consuming the amount of calories that you need throughout a day. So smaller meals, I recommend anywhere from 4 to 5 small meals a day for anyone who has prediabetes, diabetic, or if you have PCOS. I am blood sugar sensitive. I don't have anything wrong with my blood sugar technically, but I have to eat smaller, more balanced meals throughout the day or I dip low. Incorporate protein and fiber with every meal to stay fuller for longer. Stay hydrated. So hydration is, yeah, we say drink water, drink water, drink water. Well, how much? 64 ounces at minimum of water. This is not sweetened beverages. This is not, things full of other things and calories. This is water. Your body craves water. This supports your metabolism and hormone regulation. Monitor your portion sizes to avoid calorie or excessive calorie intake. And consider working with a dietitian for personalized guidance. This is not, I don't want y'all coming to me. I mean, you can if you want to. But consider working with a dietitian for personalized guidance. You can get so lost in all of these recommendations, but when you meet one-on-one with a dietitian, they can go into your personal preferences, your triggers, your eating behaviors, anything you could think of to really personalize a plan for you. So I would really recommend meeting with a dietitian. There's a lot of interest around intermittent fasting. So let's hit on that before we end. So potential benefits of intermittent fasting for PCOS. We know that there is a benefit. Research on intermittent fasting and its effects on PCOS is still evolving, but there are a few key points that I want to bring up, and this is supported by clinical evidence. Number one is improved insulin sensitivity. It enhances insulin sensitivity, which is crucial for managing PCOS. It helps regulate blood sugar and reduces the risk of type 2 diabetes. Everyone with PCOS is at risk for type 2 diabetes just due to the insulin resistance. So, in a fasted state, your body really wants to go in overdrive and go into recovery, fighting inflammation, and really improving your insulin sensitivity. Hormone balance. It supports regulation of PCOS related hormones. So, reducing androgen levels, such as testosterone, improving symptoms like excessive hair growth and acne. As far as weight management related, it promotes weight loss by reducing calorie intake and increasing fat burn. So that's not to say that you're reducing your calorie intake so much that you're not adequate in nutrition. You're reducing the window of time that you're eating. That's really up to you. Again, you have to do research on this. This isn't just, I'll just stop eating for 16 hours. You really have to have some kind of knowledge of what you're doing and why you're doing it and how it works. Again, a reason to meet with a dietitian. It helps manage insulin levels on a hormonal balance. So this in turn will ease symptoms of PCOS. Lastly is reduced inflammation. The fact that you're not eating all day long and you've got a longer rest period, like let's say you're not eating past 6 p.m., or let's say you have a 12 to 16 window that you're not eating, that amount of time your body is actually going into a fat burn stage, and it is using that time to heal, burn fat, lose weight. So your body's actually healing and fighting against chronic inflammation, which is the number one thing we want to do. So the one thing I want to point out and take away from the intermittent fasting is it's important to ensure that your patients or you, if you're practicing it, you're still meeting your nutritional needs during fasting periods. Again, we're not just saying we're cutting out a bunch of calories. You still need to be at a good amount of adequate calories to even lose weight. So a balanced diet with adequate fiber, adequate protein, healthy fats, and complex carbohydrates is critical for managing the condition. That's it, guys. That's my part. I'll hand it back over to Austin.
Awesome. Thank you, Whitney. And
You're
before
welcome.
I just want to give Dr. Katz a shout out here.
Yes.
Please check out drkatzweightloss.com. He's extremely active on social media, LinkedIn, YouTube, X. So please follow Dr. Katz. And I know we can't see everyone, but let's give him a hand. Thank you so much for joining us today, Dr. Katz. We really appreciate it.
Thank you, everybody.
Awesome. Well, just to wrap up here, I want to mention again, if you have questions for us, for Whitney, for me, if you hit reply to the Zoom confirmation email, that should go directly to Whitney. You can also check out our website, Alterra with 2 R's, alterrahealth.com. And we would love to speak with you if you found this valuable. We do these on an ongoing basis. We would love for you, your patients, to join again. I believe our next masterclass is on gut health. We just did one on menopause last month, wildly successful. I think we had over 200 providers watch that one.
Yeah.
And so if you'd like a recording of that as well, please let us know. But thank you so much for taking time out of your schedules, and we look forward to seeing you again in the next one. Whitney, anything before we end the meeting?
No, I hope we have people reach out to us. You know, we want to get in the hands of a lot of clinics and show you what we have to offer for your patients. We really like to take the work off of your plate and really work as a team approach to help everyone change their entire lifestyle, not just, you know, within the clinic, but outside of the clinic as well.
Thank you very much. Well, I'm good.
Thanks for
Dr.
joining.
Katz, any final words?
Thank you. Nope. Just basically hang in there. You're going to be able to get to the end of this journey and continue on it.
That's the
Yeah,
perfect way to end it. Thank you so much, guys. We hope you have a great rest of your Thursday and week, and we will see you next time.